We've been involved with the PiQo4, Luminous' picosecond device, really since it started, allowing us to treat a whole variety of tattoos, pigmented lesions, scars, and skin toning. Luminous has been around a very long time, and that has been good for us, and it's good for the company. Being around this long, they've put out really the best technology that exists now, with great support and great marketing, and it's great to be working with Luminous. I love PiQo4 because it's a device, a machine that allows me to do more than one thing. It is foolish to think that you're going to buy a picosecond technology and simply treat tattoos. It is true that the PiQo4 has tremendously expanded our tattoo market, but I want more from a machine. Well, we've recently conducted a study treating melasma with the two wavelengths that are on the PiQo4, two wavelengths that are not on any other technology. We know melasma is a condition of pigment, but what we've learned over the last 5 or so years is that there is a vascular component as well. That's what leads to some of the inflammation that leads to melasma. And so with this device, and we've just completed this study now, we combine both the 1064 wavelength on the PiQo4 with the 585 wavelength also on the PiQo4, and we get better results than if we use just the 1064 wavelength alone. So the paradigm for treating melasma initially was using nanosecond 1064 technology. Well, that's been around for many years. That changed over the last few years with the advent of picosecond 1064 technology. And now Luminous with the PiQo4 and the availability of both 1064 and 585 nanometer has allowed us to better treat melasma, a condition which has been impossible to treat. So we've got a bunch of happy patients who had melasma treated before who are now getting even better results because of the PiQo4. Besides the footprint of the machine, which is a very small one, so it's easy to move around, and the ease of use of the articulated arm, so that it's not heavy on the hand, and the ability to plug this into any outlet that's 110 voltage, the GUI, or the graphical user interface, is extraordinarily important. I want that to be simple, because if it's simple, then both me and all the providers in my office will get consistent results and safety will be kept at a very high level. And so what we have here are the 4 wavelengths that are on the laser. That's 1064, 650, 585, and 532 nanometers. And I'll show you the handpieces for all of those. And then the unique ability not only of having those 4 wavelengths, which we don't see with other technologies, but 4 different pulse durations. We have 2 pulse durations in the nanosecond domain, and we have 2 pulse durations in the picosecond domain. That allows us to tailor our treatment to exactly what we're trying to treat. Spot sizes all the way up to 15 millimeters, really large spot sizes, which we sometimes use with the Pico fractional device for skin toning, all the way down to 2 or 3 millimeters if we're trying to treat small bits of pigment. And then lastly, the fluences, really a full gamut of fluences depending on the spot size we use. But this machine, albeit so easy to maneuver and so easy to use, is in fact the most powerful picosecond device available on the market. So we have all those options, and all of them are available on the graphical user interface, the GUI. This is the fluence, this is the spot size, and finally the pulse rate. If you want to deliver a single pulse, you can, or it can fire 10 pulses per second. The treatment can be done literally in minutes. This is the most commonly used handpiece that I use. It's the 3 by 15 millimeter zoom lens that has both 532 and 1064 nanometer wavelengths on it. And so I use this for a variety of brown spots, tattoo pigment, melasma, a whole variety of things, and a variety of spot sizes depending on how big the area is. Similar to that is the 2 by 10 millimeter zoom handpiece. This allows me, if I want to get really small areas, sometimes if I'm treating, let's say, eyeliner tattoo, if I want to get really close in small spot sizes, it's similar to the 3 by 15 millimeter handpiece. It's a zoom lens, but if I want, I can get even smaller spot sizes and correspondingly even higher energies. But in some ways, they're very similar. What makes the device so different is not only those two particular handpieces, but this is the 585 nanometer dye handpiece, and this is a yellow handpiece. Now, this can be used to treat some tattoo pigments, such as azure blue or sky blue, but most importantly for us, we combine the use of this handpiece with its yellow color to treat the vascular or blood vessel component of melasma. So in reality, when we treat melasma, we're using both of these handpieces. There's no other device that gives us both those handpieces. So this is unique in its ability to treat certain colors of tattooing, but more importantly and much more commonly, we use this for melasma. And we see melasma in so many different skin types now. You know, we live in this cross-cultural society, all kinds of skin colors, and we see melasma virtually in every single skin type. So this has really become a workhorse for us. And then this handpiece here, this is the 650 nanometer handpiece. So this is somewhat akin to using a ruby laser. And we used to love ruby lasers, but they've kind of disappeared from the market. And they give us the best treatment for green tattoo pigment because nothing else works very well on green. So this will plug into the machine, deliver this 650 nanometer wavelength technology, and it just makes green pigment disappear on us. And then lastly, this is the PiQo fractional handpiece. And so what this does is it allows us to deliver picosecond technology in a fractional delivery system. You know, in the old days, if we wanted to take people who had a little bit of wrinkling, a little bit of poor skin quality, some dilated pores, we'd have to use a laser which created a wound. We can deliver this. We never use numbing cream with this particular handpiece. There's no wound, and over a series of treatments using this PiQo fractional handpiece, we can make better skin quality, and patients love it because there is no downtime. And so, in summary, we have all these handpieces. We have zoom lens handpieces. We have PiQo fractional handpieces. We have both the 585 and 650 nanometer handpieces. There's something for everybody. I can treat every kind of tattoo. I can treat old tattoos. I can treat new tattoos. I can treat a variety of pigmented lesions. Just generalized photo damage, freckling, age spots are known as lentigines. We treat a huge amount of melasma, and that condition keeps increasing. And then there's all kinds of scarring that can be treated with the PiQo fractional device. Where are you going to find a machine that allows you this many handpieces, this many wavelengths, the ability to treat all these things, and with virtually every one of them, there is essentially no downtime. Bringing a high-quality system such as the PiQo4 into the practice has really revolutionized our practice because it's brought us a very high-end clientele of patients. These patients, as I said, can be treated in so many ways. They might come in occasionally for an eyeliner tattoo they don't like, and the next thing I know, they're asking me to treat their melasma, and then the next thing I know, they have a tattoo on their ankle. And one machine allows me to treat all, and then they're happy with the results, and all of a sudden they want fillers for their wrinkles. That cross-selling is a huge part of what we do every day, and we can thank Luminous really for playing a role in that. Among the many things we use the PiQo4 laser to treat is melasma. Melasma has always been a very difficult pigmentation problem to treat, and it's increasing. We're seeing more and more of it in virtually every skin type that's out there. That's probably a combination of issues related to sun exposure, certainly hormonal issues, and probably toxic environment in the atmosphere as well. Having said that, we treat these people and we continue to treat them with bleaching creams and sunscreens. And we have always used simply nanosecond 1064 lasers for that. They help some. They have variable results, but they do help some. And we were looking for a better way to treat them, in particular because it's a difficult group to treat, and the numbers of patients with melasma keep increasing, I would say every couple of years in our offices. The study that we did for Luminous looked at the use of two wavelengths that are unique to this technology, that is 1064 nanometers and 585 nanometers, looking at both the pigmented and the vascular component of melasma. In our study, we treated one side with the 1064 wavelength, which has been used historically for years, and the other side with both the 585 and the 1064 wavelength, and we got better results using both wavelengths. So for an ever-increasing problem, melasma, and an ever-increasingly difficult problem because people get sun, we have found a solution now, the 2 wavelengths with the PiQo4, that works better than anything we've ever done before. Having said that, they still have to be careful with sun exposure, and we live in an imperfect world. So most patients are treated, they are improved, and then periodically, life goes on, they do get some sun, and then they're back. So you had this treatment before.
Yes.
You know that treating you with the PiQo4 laser, you're going to feel essentially nothing. The treatment takes very, very little time. It's all of a few minutes. I need your help. No matter how good a job I do, I have to have you wear sunscreens, and it's summertime. So you're wearing sunscreens, right?
Yes, always.
Okay. And she was actually in our study where we treated her with both the 585 wavelength and 1064, where we saw a better result. And you can see she still has some melasma on her forehead. Some of this probably is aggravated because even in a perfect situation, she's getting some sun. So I'm going to treat her forehead first and then a little bit on her cheeks. But she's smiling now. She'll be smiling as I do it because she'll feel either nothing or next to nothing. You ready?
Yeah, let's do it.
Here we go. So how does that feel?
I feel absolutely nothing.
That's good. I want you to keep saying that. All right. It really is a very easy treatment. There's no wound at all. And in fact, we don't want to produce a wound because if there's a wound, the inflammatory response to that can make melasma worse. So I don't necessarily have an end point. I just make sure I've gone over all the areas at least once or twice. If I hit an area that's not involved, it won't do anything to it anyway. And so when I started doing this, I would go very slowly, but since I can hit normal skin and do nothing, it doesn't really matter. But it's a painless treatment. And the interesting thing is it's helping to treat her melasma, but the wavelength itself is also going to have an impact on water and collagen, so her skin quality will improve by doing this. And so this is really the treatment of her forehead. She has a little bit on her upper lip. Close your lips for a second. Good. We'll do that. A little bit on her cheek. And a little bit over here. And so there's a little red aiming beam. It tells me exactly where I'm treating. And she'll leave here and nobody's going to be able to tell she did anything, which is really what we want. People these days want less and less downtime, and with this device, there's none. And that's the treatment. How you doing?
I'm doing good. Didn't even feel like anything.
Okay, good. She didn't feel a thing. That's terrific. Our expectations from the treatment are really exactly as what you can see, and that is there's no wound at all. She's going to go about her business. She doesn't have to wear any extra makeup. She's not going to see improvement after one treatment. That's not the nature of treating melasma. We generally treat this over a series of treatments. Usually start with 5-ish treatments, and it's anywhere from 2 to 4 weeks apart. And generally by the second or third treatment, she'll begin to see something. We'll do 5 treatments, we'll stop. Melasma is not a curable condition, it's a highly treatable condition. And so as long as our patients are wearing good quality sunscreens, we'll do those 5 treatments, and then after that perhaps once every 6 months, a single treatment. But she'll get a great result, and she'll be happy and come back for other things as well.
Yeah. My name is Julie Wilson, and I came to Dr. Goldberg's office to get treated for the PiQo4 laser. I noticed that I had some melasma on my forehead, and so that was my main reason for coming in. And I noticed that the more treatments I got, the better it helped. So I had about 3 to 4 treatments with them. I noticed changes in my appearance probably about a week or so after the first one. And as I had more treatments, it got progressively better. The treatment was very fast. The treatment lasted, I would say, maybe 5 minutes. It was very quick. I'm very happy with the results.
I love PiQo4 because it's the only device that allows me to treat a whole variety of tattoos, new and old tattoos, a whole variety of colors, a whole variety of pigmented lesions, skin toning and scars, and most importantly, is the only device that gives me the best results in treating melasma.